I'm really excited to work with Dr. Greenblatt in providing a pediatric functional psychiatry fellowship. Children are not small adults, and we really are providing a way that practitioners can find the community, the care, the tools, the formulations, the dosages, so much that we can provide to children that is very different than what we do for adults. So I'm really excited to be doing this with Dr. Greenblatt.
A functional psychiatry program for pediatrics is something I've been thinking about for many years and just very excited to be able to work with Nancy O'Hara on this project. We have talked for too long about a crisis in mental health care for children and adolescents. And what Dr. O'Hara and I have kind of bonded on over many years, that it's not just an epidemic in numbers, it is the crisis of care of the model. In this fellowship, Functional Psychiatry for Children, we will be providing practical, clinical information for practitioners to just improve outcomes and change a path of mental illness for so many kids that are suffering.
What we're doing and what we're providing is that root cause care, getting to what's underlying the anxiety, depression, psychosis, and all of the mental health issues that our children are going through.
Our Pediatric Functional Psychiatry Fellowship is a unique opportunity for pediatricians, nurse practitioners, and child psychiatrists to engage in the same conversation. Pediatricians have been in the front lines of mental health. They don't always have adequate training. Our child psychiatrists are only focused on symptomatic-based medications, and our nurse practitioners are being asked to do a little of everything. In this child psychiatry fellowship, Dr. O'Hara and myself and our faculty will provide the bridge to help pediatricians understand root cause of major mental illness in children, and for child psychiatrists to understand the importance of nutrition and functional medicine.
One of the things that I find so unique about this pediatric fellowship in child psychiatry is that it is not just lectures. It is not just formal teachings, but live supervision, office hours, communication with colleagues, and a real community where child psychiatrists, nurse practitioners, physician's assistants, pediatricians, practitioners of all types can come together and learn how to effectively treat children with neuropsychiatric conditions in a functional medicine, integrative, holistic approach.
The Child Psychiatry Functional Medicine Fellowship is unique. We are providing training opportunities for almost 7 years now in general psychiatry, and we've been asked to focus on children. So the fellowship provides opportunities for everyone to learn. Besides the lectures recorded that you can listen to at any time, there are live group supervisions where you get to interact with Dr. O'Hara and myself and a unique faculty with specialty training in child psychiatry and pediatrics. And then there's a learning opportunity that I think is unique, and that's our community forum, where physicians and colleagues around the globe are interacting on a daily basis. People are presenting cases, sharing articles, sharing protocols, and support. And that community interaction has been a unique part of our program, and it's a unique part of how I think the Pediatric Fellowship is unique.
And one of the things that I have found most unique about this pediatric fellowship is that it is if you have a whole team working with you, a team that can help you learn, but also apply what you have learned to your practice. And I have found that my satisfaction in working with children and families has greatly increased in looking at things in this way, in having a team that I can collaborate with online at my own time and together with other colleagues, especially Dr. Greenblatt, but other faculty members, to help each of us learn and grow as we care for these children and families.
I talk to clinicians around the country, actually around the globe, on a daily basis. And many doctors that I'm speaking to start with the same comment. My patients want alternatives. My patients are asking about nutritional supplements, and I didn't learn any of this in my training. There is limited training in nutrition, there's no training in functional medicine, and the time is now. The good news is functional medicine is getting an audience, and people are talking about it, and people can appreciate the role of root cause testing to support mental health and mental wellness. In our fellowship, we strive to help clinicians understand not just the facts, not just what you get at a conference, not just what when you get when you read a book, but the practical implications of how to treat patients. I've been in this situation, and I know many of you have, going to a conference, get really excited about a topic, and then sitting in front of a patient paralyzed because you really didn't understand the complexity of that functional test or that nutritional supplement. In the functional pediatric fellowship, we have faculty and staff who will mentor and support, and more importantly, answer your questions to be able to provide the clinical expertise to improve outcomes. The vast majority of our fellows have shared not only gratification in their career, but feeling gratified in the dramatic improvement in patient outcomes.
So, why this pediatric fellowship? Why now? Why should you do it? I can only say that what we've heard again and again is that families are asking for it. Families are asking for nutritional supplements, ways to look at root causes. Children are ill right now. They're anxious, they're depressed. We need answers. And not only do we provide information to help you provide better care to your families, what I found and what so many of the conference attendees and fellowship members have found is that they are more satisfied in their practices, in their careers, and in caring for the families that they take care of.
How many times have your patients asked you about nutritional supplements? I would guess 5 years ago, it might have been a few. And in the last year, it's probably most of your patients. And I talk to clinicians every day, and they use words like embarrassed, that they don't know the answers, but they want to. And it's imperative that we understand nutritional deficiencies, functional medicine, the role of diet, the role of infections in mental health and mental illness. Fellowship is unique in that we're not describing a single model of care. The Pediatric Fellowship is a program to help clinicians understand and translate the fact that every child, every adolescent is unique and testing is critical. It doesn't mean by looking at a functional medicine model that we've eliminated the role of medications. In the Pediatric Fellowship, we'll actually have child psychiatrists available for medication supervision. Our children sometimes need medications, but the goal of this fellowship is to help clinicians look at root cause first, if possible, understand where medications might fit in, and most importantly, understand how to minimize side effects of many of the medications that our children are taking.
Have you heard of PANS or PANDAS? Do you know what it is, but don't know how to treat it? Do you even believe that it is a disease or a syndrome that should be treated? We are going to do a deep dive in this fellowship into all pediatric and young adult infectious and metabolic triggered syndromes, neuropsychiatric symptoms like OCD, anxiety, tics that may follow an infectious or metabolic trigger like strep, mycoplasma, COVID, tick-borne diseases like Bartonella, Babesia, mold, and many, many more. This pediatric fellowship will take a deep dive into all of these issues. There's nothing else like it, so join us.
We are in a crisis. As a child psychiatrist, I am frankly overwhelmed with the quality of care that our children are receiving. Our current model is not adequate. Therapy and medications aren't adequate. It is time we understand that the crisis is the model of care. And as clinicians, you need to understand a root cause functional medicine approach. It doesn't replace all the other tools that we've been trained in. It augments the care. It provides a path of hope, and outcomes are just better. I'm excited to be part of this pediatric fellowship with Dr. O'Hara and an expert faculty who will share their clinical experience, the evidence-based research to improve outcomes. Children suffering, tremendously suffering with families with mental illness.
Dr. Greenblatt and I have been working in parallel fields for the last several decades, and I am really excited to come together with him and other expert faculty to provide each of you with the tools that we need, the evidence-based, research-backed tools that people are asking for, that each of us need, and that you really need to grow, augment, and help your practice and the families in your practice be the healthiest they can be.
All of us have experienced mental health challenges in our family, our neighbors, our friends, and certainly the patients that come to see us for help. And if you take a step back and think about it, what would you want to do for your loved one? Provide multiple medications based on educated guesses? Or look at root cause, look at hundreds of biomarkers to understand, is there an infection? Is there a nutritional deficiency? Is there a hormonal imbalance? If you take a minute and think about what would be important to you or for your loved one, I think the answer is pretty simple. Testing first. The Pediatric Fellowship that Dr. Nancy O'Hara and I are organizing for this summer will provide you the tools to learn how to address root cause analysis for children suffering with mental illness.
Do you have a child or do you know a child suffering with anxiety, OCD, tics, an eating disorder? If so, this pediatric fellowship is just what you need. It's a personalized, precision-based root cause approach that you will learn and be able to apply in your practice. So join us.
The Pediatric Fellowship will provide you the opportunity to gather information, to learn the science, but more importantly, to apply the information to support your patient care. It's challenging to incorporate this information after going to a conference or reading a great article. The mentoring and the support that you will get in the fellowship will provide you all the tools to implement this work in your practice. Please join us. If you have questions, we're happy to talk to you to see if it's the right program for you.